Women's heart attack symptoms are very different from men's. You need to know the danger signs. It could save your life.
As we imagine better health, we are turning to CHI Health at the forefront of cardiovascular care. They have one of the nation's highest quality award-winning heart programs.
Dr. Scott Carollo is an interventional cardiologist with CHI Health. Good to see you, doctor.
Good morning.
And it's quite appropriate that we have a cardiologist here after our visit with those snakes.
Wow. Yeah. That was
Nick
something.
and I, we have a problem with snakes.
I'm not sure what your fees
are. You having some
but...
palpitations right now?
We had a few of something.
Yeah.
But listen, all seriousness though, women experience different symptoms when it comes to heart attacks, right?
That's true.
Break
That's
that.
true.
What
you know,
is
we
it?
all think about heart attacks. We think about that gripping, centralized chest pain that people collapse on. Women are different, as we know, in so many different ways. And they don't completely manifest things like we do in a textbook. The thing that really perks up my ears is when a woman comes in with just generalized fatigue or maybe shortness of breath, something along those lines. So very unusual types of symptoms. That's really when we start to have to be concerned.
Yeah, and you can see the upper back, the jaw pain, discomfort in the neck area too.
Yeah.
And those aren't the typical, you know, I'm thinking left arm,
exactly,
gripping chest pain like you said. Yeah.
Exactly, exactly. So women are really different, and you really have to have a low threshold when you're talking with women.
And what I think is very interesting when it comes to heart attacks in women is women seem to be more in tune with their bodies than guys. But when it comes to heart attacks, they're less likely to seek medical care when those symptoms creep up.
Yeah, you're absolutely right. And unfortunately, you know, this is the #1 killer of women in the United States. And we're all aware of cancer, breast cancer, uterine cancer, ovarian cancer. If we summed all of those up, heart disease would be twice that number in deaths. So women need to pay attention to their bodies. And you're absolutely right. Women are so in tune to their bodies. They know that something is up. They know that something isn't right. And what we want them to do is to respond to that change and say, hey, maybe I should go get checked out, especially if you've got a strong family history or notable heart risk factors.
And is that kind of the way to go if you're not having direct symptoms, just to kind of stay on top of it, just to make sure you get your regular physicals, your checkups?
Absolutely, absolutely. The sooner we get on top of things, the better off we're going to be, especially if women have a known history of family heart disease, or they've already been diagnosed with some risk factors, or maybe they're smoking. Those are things that we really want to get in front of, and the earlier we do that, the better it's going to be for everybody.
Well, you talk about that early intervention. Primary care physicians, I'm sure, play a huge role in this. How big of a role is that? And talk about that relationship with women patients and their primary care physician.
Yeah, I think it's absolutely critical, because if you've spent some time with a primary care doctor, they've gotten a chance to know you, to understand you. And maybe one day you come into the office and you just don't seem right. And they can pick up on that type of thing and really start to listen to some of the symptoms you're giving and start to investigate things more aggressively.
You talk about knowing your numbers. What are the numbers that people should be aware of in themselves?
You know, we all have to know our cholesterol numbers. I mean, everybody has to know those. In my lifetime as a physician, it's been transformative. Controlling cholesterol has changed the face of cardiovascular care. We all need to know those numbers, know where we're supposed to be, and if they're high, let's get them down. If we get them down, we're going to do great down the road.
Yeah, and you mentioned smoking, though. That's another big indicator. And not only current smokers, but former smokers too, right?
Right, across the board. I don't know what you guys think, but it's really disturbing to me how things have seemed to have changed in the last decade. I drive down Dodge Street and I see people with one arm on the steering wheel and another with a cigarette at the end. And it's been years since I've seen that happen. It just seems like that's been a big deal. If I had one wish, I would eliminate cigarettes. And I think that would change the face of our healthcare across the country.
And for so many other
in so many other ways
as well.
Absolutely.
Yeah.
No. It seems like a lot of women, I always hear them focusing on reproductive health, maybe breast health, but why isn't heart health right up there with some of those concerns and worries by women?
You know, I think part of it may be because women tend to manifest this disease process much later in life and maybe not focus so much on their risk factors early because they've got so many other responsibilities at work, in the community, and obviously at home. But I think we need to start spending more time about being preventative and doing it in an earlier standpoint.
It's a really jarring statistic when you hear, I mean, when I was reading this morning, that the death rate is much higher than all of other female cancers combined.
Twice as many.
Twice as many.
One in three women are going to die from heart disease. That's one woman every minute of the day.
Yeah. All 6 of your metro hospitals, they have chest pain centers. Why is that so important? And we're showing this list to our viewers.
It's so important because it allows a venue for people to come in and get evaluated. Sometimes people feel like, oh, I'm going to be wasting people's time and et cetera. We have a whole system at all of our metro hospitals that's specifically designed to take a look at people with all kinds of funny symptoms, chest pain symptoms, shortness of breath, fatigue, and we investigate things and we begin the process of evaluating them and, if necessary, initiating early treatment.
And I would imagine it's a happy day for you when you can send somebody home who's not having a cardiac event,
Absolutely.
right?
It's a win-win for everybody, and it's fantastic.
Yeah, one word that you want women to take away from this conversation today, or one thought?
Awareness. Awareness. I think that's the number one thing. Take some time for yourself and take advantage of the preventative measures.
Dr. Carollo with CHI Health, great to have you back on the show. It's been a while,
Yeah.
so it's good to see you back here
Yeah,
again.
thank you. Thank
Good
you.
to see you.
Thanks
Yeah.
a lot. Yesterday's